Good evening. Nancy Reagan said, when people say you have Alzheimer, you have no idea what Alzheimer is. You know it's not good. You know there is no light at the end of the tunnel. That's the only way you can go. But you really don't know anything about it, and you don't know what to expect. The modern rise of Alzheimer's disease in the 20th century is not a sign of failure. It's a sign of success. Success in living long enough to see that disease expressed. Although there has been warning that it was coming for years, the Alzheimer epidemic is here now, and millions more families will be touched by this progressive and ultimately fatal disease unless its course can be altered. Dementia is often regarded as an embarrassing condition that should be hushed up and not spoken about. But I feel passionately that more needs to be done to raise awareness, which is why Time Waits for No One became an ambassador for the Alzheimer educations. Today, it's my pleasure to welcome Dr. Anu Gard, who is the Certified Medical Director of the Geriatric Medicine, who is expert also with Alzheimer's disease, which is our subject today. Thank you for being here, Anu.
Thank you for having me.
We want to talk about Alzheimer in general and try to orient our viewer about the disease and to understand the basic, at the same time, the advanced treatment available for that disease. So can we start by defining to us what's Alzheimer's disease?
So let me start by saying that dementia is a broad term and Alzheimer's disease is a type of dementia. In fact, most common type of dementia, 80% of dementia is Alzheimer's type. And that's a big question in the office when patients come and say, well, you said my loved one has Alzheimer's, but we were told she has dementia. What's the difference? No difference. It's just the type.
Now, with the dementia, we are talking about, in general, the term of memory loss.
Memory loss,
general,
correct.
Okay?
So, but in general, when patients come, they are thinking memory loss, but it is so much more than memory loss. There's problems with abstract thinking. There's problems with day-to-day activities. They can have problems with their language, with their visual spatial, orientation, problems with calculations. So all those stuff that helps us with our day-to-day life, there can be problems. So it's just more than just a memory loss.
Sure. And in general, the Alzheimer's disease is the disease of the elderly.
We're talking somewhere in 70s and 80s, and that's a big thing that differentiates it from the other types of dementia, something like Lewy body or frontal lobe or even vascular dementia. They tend to happen more in the younger population. They tend to progress much faster than Alzheimer's, and they don't do so well with medications like Alzheimer's does, so making them much more difficult to manage.
And Alzheimer's disease is a disease which is, like what you suggested, it started at early stage, for example, at specific age, and get worse over the time.
Alzheimer's is a progressive disease. It is an irreversible disease, so whatever we have in terms of therapy or intervention is only going to slow the decline. We can't reverse it, we can't stop it, we cannot bring back any of the functions which is already lost. And right now, we have about over 5 million people diagnosed with the disease. And unless we come up with some sort of solid intervention, where projected number is up to 3 times, 15 million by 2050.
Wow. And so what you are suggesting, that treatment could slow the progression in general, or it has no effect on it, just improving the symptoms?
Treatment is, as far as what we have on the market right now, is only slowing the symptoms, only slowing the decline of memory, that too in more early and moderate stages.
Sure.
It's not really effective or bringing back any of the lost function at all.
I see. And how important is the non-pharmacological treatment? Now, we know about medications, which is, we're going to talk about it a little bit later, but what about the family support, the medical support, the community support for those Alzheimer patients when they have it?
So as soon as we label somebody with a diagnosis of dementia, we advise the family members to do a few things. Make a list of things, for example, do their advance directives, get their living will in order. Sure. Make sure that family understands the course of the dementia, which is progressive decline. make sure that families connected to the community resources like Alzheimer's Association and Area Office of Aging. Also, making sure that they make long-term goals with the patient. Where will they be placed had they needed more help? If they're not able to care for them at home, who's going to be their support? And those kind of, we try to prep them to make those arrangements early on.
And how is the Alzheimer Association playing a role? I mean, do you refer people to the association to coordinate that effort for most of those patients or their family who doesn't know anything about it?
So one good thing is in our office we have what we call collaborative care practice, where every patient, when I see them and after I do the diagnosis, are seen by a behavioral health provider, which is a psychologist, who will go ahead and address any concerns like behavioral issues or depression or agitation or caregiver burnout, those kind of things in those patients. Then these patients are also seen by the social worker who will address any social issues, financial issues. And that's when, if we determine any of those needs or they have any community resources that they're going to need, then we go ahead and connect them to Alzheimer's Association, who's phenomenal in supporting, giving support to the family, providing them with resources, helping them with respite care, and educating them.
This is a very difficult and terrible disease, and unfortunately, like what you suggested, the resources regarding treatment is very limited. How can you talk to the family members about that disease and try to explain to them how important for them to take care of that individual who is developing Alzheimer and getting worse over the time?
So we start by providing whatever resources we have, literature, which is more like, basic language that the family members can understand. And just, we have to describe to them that it's happened and it's not something that, pathology, that nobody could have detected that it was coming on. So it's nothing wrong that they did. And now that it's happened, we're going to utilize all the resources that we have to do whatever we can.
When we are talking about the treatment of Alzheimer and the pharmacological, I'm talking about the medications. Can you give us an idea about the current medications available, how effective, number one, and how many of those available? Because that's the first thing the patients or the family members ask about. They want to stop the process of that disease progression.
We have two medications in the first class, which commonly known as Aricept, donepezil, and then we have an Exelon patch or pill form, which is rivastigmine. Both of those are more for early to moderate stages of dementia. And then the third one, which is memantine, Namenda, that is for moderate to late stages of dementia. Again, the modest benefit that we get is early stages and then also to delay the progression of the disease. Not so much reversing or bringing back what we have already lost.
And from your expertise, what is the lifespan of Alzheimer's disease? Like the people, when they start the disease until they develop the advanced stage, like how many years it takes?
From the time that you got diagnosed and that time to death is 10 years. So that's your median, so 5 to 15. But how many times do I see them at the beginning? I don't. I usually see them when they have gone unnoticed for a few years and one family member happens to notice and then they said, oh, maybe we should get it checked out. I'm already 3 to 4 years behind on that. So that's what happens. So there's two ways in our clinic. We can either catch the patients when they come in and we screen everybody, or when family brings it to our notice and then we screen them.
And you said the word screening. What are the screening methods which you are using? I mean, just to educate the public, maybe they can do it on their own.
Well, there are tests out there. For example, we use one test called SLUMS, which is St. Louis University Mental Status Exam. It has a series of questions which test you on your knowledge, in your memory, your language skills, calculation, abstract thinking, complex tasks, visual spatial skills, and then all that put together tells your clinician, how you're doing. There is mini mental status exam and MOCA, sort of similar tests that we do. And then in addition to that, your clinician will do blood test to rule out any organic causes, to make sure that we're not missing something else which is masking the symptoms, and then also maybe a head CT or MRI to make sure there's nothing organic happening before we diagnose or label you as dementia.
We really appreciate you being here, and we appreciate your knowledge and expertise, and thank you so much, and thank you for being part of the Alzheimer Association also. I think your support and the community support for that organization is very important.
Thank you so much. I just want to reach out to families and patients by saying, get screened, get checked out. Worst case scenario, the earlier we catch it, more we can do for you.
Absolutely.
Thank you.
Absolutely. Thank you.
Who says you can't get a house call anymore? Cardiovascular Physician Management specializes in outpatient services, offering high-level care in the comfort of your home. Imagine a physician's assistant, nurse, or therapist visiting you, contacting a cardiologist, and adjusting your meds or treatment plan to fit your progress. If your doctor prescribes home health care, think of CPM, Cardiovascular Physician Management. Call 419-251-6100 or online at cpm-homecare.com.
Every day you listen to the news, but how is that news affecting your financial world? Things like your retirement and your kids' college fund. You need someone who can help you work towards that goal. Someone to help you move forward in these times of change. Call the Roop Prisby Williams Group at Morgan Stanley. Joel, Jim, and Deb each have 25 years of experience as financial advisors, and their team is right here in Northwest Ohio. To make an appointment with Joe, Jim, or Deb, call 419-842-6505. Investments and services offered through Morgan Stanley Smith Barney, LLC. Member SIPC.
You're living a full and productive life because you've always committed to giving the best of yourself to everything you do. And there's so much to look forward to. Children's weddings, the second honeymoon, your philanthropic work, just to name a few. The dedicated physicians at Toledo Cardiology Consultants are committed to your cardiac excellence, so you'll be there for the experiences of your lifetime that are yet to come. To learn more, visit Toledo Cardiology at toledocardiology.com. That's toledocardiology.com.
Welcome back. It's my pleasure to welcome Dr. William Messer, who is the professor of pharmacology at the University of Toledo, and who is also going to be involved in the research related to Alzheimer's disease, which is our subject today. Thank you for being here, Bill.
My pleasure.
Thank you. I want to educate the public about the Alzheimer in specific. Can you give us an idea about what's Alzheimer's disease?
Alzheimer's is a neurological disorder that involves a loss of memory function, primarily affects the elderly, although it does impact individuals at earlier ages in some cases. It's associated with neuronal pathology, so it's a brain neurodegeneration disorder that involves some characteristic neurochemical hallmarks like amyloid plaques and neurofibrillary tangles, which means that there are proteins deposited in the brain, and that neurons die as a result of some processes that are starting to be fairly well characterized now.
Now, you said that it's mostly affecting the elderly, but also it could affect the younger generation, I mean.
Right. So age is the biggest risk factor for Alzheimer's disease, and there's a type of Alzheimer's called sporadic Alzheimer's disease that primarily affects the elderly, and as people age, the risk of Alzheimer's disease increases.
When we are talking about age as one of the common indicator for Alzheimer's disease, now, so what's the main reason for developing? I mean, how does it start? What's the etiology?
We know that there are specific proteins, protein alterations that are associated with Alzheimer's disease. One of those proteins is called amyloid. Amyloid is a small peptide that's found in the brain. It's a normally occurring peptide, but in Alzheimer's patients it accumulates in amounts that are large, and it forms plaques that appears to compromise brain function and causes pathology.
Bill, you mentioned the amyloid and the proteins, which is correlated with the Alzheimer level. Can you explain to us what does it mean, protein and amyloid protein contributing to that factor?
Sure. Well, proteins are naturally occurring compounds in our body, and amyloid is just one kind of protein. There are enzymes that break down these proteins into smaller fragments, and amyloid is one of those small fragments of a protein that is found in everybody's body, but in Alzheimer's patients, it either accumulates at a much higher level or it forms larger fragments, longer fragments that can be toxic to the brain. And so amyloid peptides are just smaller portions of the larger proteins. A peptide is just simply a small fragment of a protein.
So it's a large chain, which is a protein, and the amyloid peptide is a very small part of that chain.
Exactly. There are definitely genetic risks associated with Alzheimer's disease, and alterations in either amyloid precursor protein, the large protein that amyloid derives from, can lead to Alzheimer's disease. So mutations in this precursor protein can lead to an increased level of amyloid or a larger fragment of amyloid that gets deposited in brain. There are also other genetic factors, such as presenilin mutations, that alter the formation of amyloid. So these genetic factors provide clues about what might be happening in the etiology of Alzheimer's disease. So we know then that, that targeting amyloid might serve as a way to treat Alzheimer's disease or to prevent Alzheimer's disease.
There's different stages of Alzheimer's disease, and the sooner we make the diagnosis, is it possibly that we stop it or improve the chance of not to get to the advanced stage, or it's really no matter what, it's going to get to that point?
So I think we're learning a lot more about that right now. It would be great if we could say, here's the specific steps of the disease. We have drugs that can intervene at specific stages and prevent Alzheimer's, but we're not quite there yet.
Okay. And that brings me really to the question that the scientific advancement in discovering the new treatment for Alzheimer is a little bit slower comparing to the other disease, like heart disease, for example, where I see every day almost there's a new drug. On the other hand, in Alzheimer's disease, not that many changes happen in the last probably 10, 15 years. There's a reason for that?
Well, I think there are a few reasons, and one is that the brain is a complicated organ.
That's true.
The brain is designed in many ways to keep compounds out of the brain. Sure. So any new therapy has to overcome what we call the blood-brain barrier to allow the drug to get to the target tissue, the brain. The blood-brain barrier is a gate that prevents the flow of potentially toxic substances into the brain. This is normally a really good thing, right? We don't want toxins that our body might ingest, or that we might ingest, from moving from our bloodstream into the brain. That's helpful under normal circumstances, but drugs also can be excluded from the brain, and that's what this blood-brain barrier does. And so it's a challenge to get compounds that might have beneficial effects across this blood-brain barrier. So that presents challenges for drug development. The other part is that the Alzheimer's is a very complex disorder. It seems to involve a sequence of events, and it's been difficult to identify compounds that work at the specific targets that we've been looking at. Pharmaceutical companies have come up with a number of different ideas, and in fact they've even identified ways to intervene to clear proteins like amyloid from the brain. But one of the problems we've run into is that we've tested those compounds in advanced Alzheimer's, where damage has already occurred. And some of these therapies show some promise because they seem to be able to remove amyloid from the brain. Yet because we've been looking at the advanced stages, we really haven't had a chance to see a true impact of these kinds of compounds. So I think that's led to a kind of a sea change in how we approach Alzheimer's, where we're looking at an earlier standpoint, at an earlier stage in the development of the disease, to try to target these proteins before the dramatic changes take place, before there's such a high level of neurodegeneration that it's not possible for the brain to come back.
You know, at one point when we used to talk about cancer, nobody predicted that we will start finding a cure for cancer. Right now, with some genetic treatment and some new technology, they are able to do that. Right. The question to you as a scientist, do you think in our lifetime we're going to find the cure for Alzheimer's disease?
I do. I do. Now, I'm accused of being an optimist.
Sure, absolutely. We should be.
But I think we have to be. I think we have to look very carefully at the clues that we have. We've identified many of the major culprits in the disease. We've identified some potential therapies, and now I think we're working on the right approaches to putting those pieces of the puzzle together so that we'll have a cure.
We appreciate it so much, and thank you for being here, and wish you the best of luck.
Thank you very much. I appreciate the time.
Good evening.
Get caught up and educated with past episodes of Time Waits for No One. Go to YouTube and search for Toledo Cardiology Consultants to find our channel. Then click to subscribe so you never miss an episode.
Remember, time waits for no one. It's my pleasure to welcome here Cheryl Connelly, who is the Program Director of the Alzheimer Association in Northwest Ohio. Welcome here, Cheryl.
Thank you.
We're trying to educate the people about if someone who one of their loved one was diagnosed by the physician, by the neurologist, that they have possible Alzheimer at the early stage or at the late stage. And they recommend to them to contact you. How is that process done? What can they do? How can they reach out to your organization?
So we have a 24-hour helpline, and it's 800-272-3900.
Okay.
And people call us. Sometimes it's, my father has it and we're having these particular problems and how can we deal with it? Oftentimes it's communication issues that I don't know how to speak in such a way that he or she will understand me.
Mm-hmm.
Or it might be the person themselves. I just got diagnosed. What do I need to know for my future? How do I plan for that?
Mm-hmm. And basically, the patients, what are the program which is you are able to provide to those people? I'm sure you have it at different stages.
So we do have this 24-hour helpline where all kinds of questions come in.
Mm-hmm.
And then we have more individual care counseling, where we can sit down with a person or a family and really try to come up with a plan for the future. We also have what we call early stage programs. People who have the disease know they have the disease and they realize they're withdrawing, and so they need more social engagement.
So it's an individual treatment plan, basically, you put it for that patient?
Very much so.
And do you have any group sessions or group plans?
Then we have caregiver support groups, and they're throughout our 24 county area, because we serve 24 counties of Northwest Ohio. And caregiver support groups tend to meet every month. And then we have maybe 6 or 7 support groups for persons who they themselves have the disease.
Sure. How is the satisfaction of the community, the people who you are dealing with? I'm sure you see a lot of people. And,
the enthusiasm for the Alzheimer's Association is always very high. I sometimes wonder, though, if we don't get a population of people who are a little bit biased because they're already engaged, they already know, they've been in touch with their physician, they know they need to be working on this.
And how is the medical community supporting your organization and your program? I mean, are the physicians are involved sending you patients? I mean, there's a good relationship with those doctors in general?
We do get some referrals from physicians. I think when physicians become aware that after the diagnosis and the management is done, that it could take long time. It could take an hour and a half for just one phone call to talk to someone about changing a whole lifetime of communication, or how to get someone to take a shower or to stop driving. And so I think the physicians appreciate that there's someone who has the time to talk to families.
And from your experience where you're dealing with the Alzheimer patient, and we know how difficult for them to take care of themselves. When I was interviewing one of you guys on the radio, they mentioned the daycare for those needy people. I mean, can you tell us something about it? I was very impressed with that idea.
So there is an adult day center. It's a separate spin-off organization that we call the Alzheimer's and Dementia Care Center, but we're still deeply involved in it and work in there and everything. So people come just during the day. It's a day center, and it gives the family a chance to go to work, or if they're perhaps retired, at least gives them some respite, a break. But it's also the person themselves who's getting benefit, because too many times if we have dementia, we're just sort of sitting around.
Absolutely. That giving them the idea to be involved with the other people who, especially they are at the same level probably of their advanced disease where they can communicate with each other in a much easier way, probably.
Exactly. It's not so much the early stage folks, it's the people who are more moderately to severely impaired, who mustn't be home alone. And
I mean, you're doing, guys, a great job in town and in this area in Northwest Ohio. We really appreciate it. So for the people, and I know that there's a lot of people who are willing to support and they want to support your organization, how can they do that? How can they donate money and try to support you as much as you can? And I'm sure you are always in financial need.
yes, we very much depend on individual donations. That's what keeps us going. We have seasonal events. There's a walk, there's a gala, there's a longest day program. So throughout the year, but also people could be making memorial donations in honor of somebody, or just donating through the website, which is alz.org.
Thank you very much. We appreciate you being here, and we really thank you again for this community service you are doing, as you are doing a great job. And many, many people, I heard it from them, that they are very appreciative for what you're doing.
And we see it as a great honor to deal with these wonderful families and individuals.
Thank you so much.
Great. Thank you.
No matter who you are, what you have accomplished, what your financial situation is, when you are dealing with the parents with Alzheimer's, you yourself feel helpless. The parents cannot work, cannot live alone, and is totally dependent like a toddler. And as the disease unfolds, you don't know what to expect. Alzheimer's disease attacks the two things most central to our personality, language and memories, which together make up an individual identity. Alzheimer make a new characters out of a familiar person. This is why Alzheimer is such a terrible disease. The body of the person you love is there, but they have gone, and they become your child, and you have to look after them as you would a child. For that reason, try to screen your parents. Try to screen yourself, especially in the families who has Alzheimer's disease, because remember, time waits for no one. Good evening.
Get caught up and educated with past episodes of Time Waits for No One. Go to YouTube and search for Toledo Cardiology Consultants to find our channel. Then click to subscribe so you never miss an episode.
Remember, time waits for no one.